Yes, hello everyone. My name is Guillaume Corpart. I'm the head of the healthcare practice at America's Market Intelligence, and I'm also the founder of Global Health Intelligence. Thank you all for joining us today. When we look at healthcare in Latin America, we really see a very big opportunity. We're talking about 1/4 of the world's hospitals, so approximately 22,000 hospitals across the region. This amounts to approximately 1 million hospital beds and 50,000 operating rooms. So it really is a huge opportunity. However, at the same time, there's also many challenges to operating healthcare in Latin America. The very first of which is the fact that the average hospital in the region has approximately 45 beds. This compares to approximately 160 beds in the United States. So any technology company or heavy equipment that's very capital intensive is very difficult to sell and to penetrate within the Latin American market. Also, anything regarding the scaling of a business, or that's required a lot of leveraging in terms of the infrastructure in place, also might have a hard time penetrating. So if you're a technology company, an equipment manufacturer that's really looking to sell into Latin America, pinpointing and targeting your clients can be challenging. When we're looking at the megatrends, we see that there's really 3 megatrends that are shaping the face of healthcare region-wide. The very first of which is the aging population. And as John touched upon, we're seeing that the demographic age group of the 60-year-olds and above expected to grow by over 3-fold between 2015 and 2055. They will then represent approximately 200 million people across the region, approximately 20% of the population. So increasing the cost of healthcare and the burden to healthcare region-wide. The second megatrend that we're seeing is the obesity epidemic. To many of us here, it's no surprise to hear that Mexico is the heaviest country in the world per capita. But it is a bit more surprising to hear that other countries, such as Argentina, Chile, Peru, and Brazil, are also showing high rates of adult obesity, reaching and even surpassing 20% in most cases. The third megatrend that we're seeing affecting healthcare is the lack of efficiency across institutions. So how efficient are healthcare institutions, specifically hospitals, in treating and addressing maladies and caring for patient health, not just for the sick, but also for the population health that ensues. So these are 3 megatrends that are really affecting the cost of healthcare and increasing the costs moving forward. On the other end of the equation, we're seeing a tightening of government budgets. So governments are not necessarily spending at the same rate that the population needs for health to be sustained across the region. The only way to reconcile these 2 major driving forces is through improved efficiencies. Okay? And what do we mean by that? So improvement of healthcare region-wide in terms of how care is being delivered and how efficient it is at solving some of the problems. Some specific examples include in Mexico, how the public system and the private system can work more hand in hand in order to deliver better care and faster care. In contrast, we see that working in countries such as Brazil. It's really hard to change any systems when we're not measuring them properly. And one element that our clients are often mentioning is that there's a lack of metrics and a lack of standardized tools to measure elements in healthcare. One example of this is the use of coding systems for procedure volumes. We see that in Colombia, the ICD-9 classification system is used, whereas in Brazil, more homegrown systems are being used, such as the TIS and the TUS. In countries like Mexico, we see some public institutions using ICD-9, others using ICD-10, and others not using any, making it very difficult to change a system when you can't measure it properly. There's also a lack of technical staff within institutions. And we're seeing that hospitals across the board that are really able to hit their budgets and grow, do so through savings not on a cost basis, but really through improvement of their supply chain. So more use of just-in-time technologies, better care for better use. So having the right technology at the right time or the right product at the right time for the right patient. Across the board, we see that access to healthcare is a major issue, but it's not just a question of access. It's a question of access to quality care in a timely manner. Right? And that's what Latin America really needs to solve moving forward. One common element that we see from all our clients is a general lack of information when it comes to healthcare in Latin America. And if we could go to the next slide, please. And this lack of information makes it very difficult for our clients to make decisions as to whether to enter the market or how to grow in the market. So here we've decided to share 3 case studies of real clients in 2019 and how they've been able to overcome this lack of information in order to make some strategic decisions and grow in the market. And hopefully these will be useful and interesting to you. The first of which is a client that was looking to make a pre-launch decision. They were looking to sell a multi-million-dollar equipment within Latin America, but first needed to understand what this opportunity actually represented for them. Given that this equipment was never sold in the region before, they needed to use proxies in order to see which hospitals and which countries had the highest potential, not only for purchasing their equipment, but also for adopting it. Because in many cases, having the right technicians in place to operate the equipment is just as important as having the financial means to acquire it. So in this case, we help them run some proxy modeling, some multilinear regression, and other statistic models and tools in order to identify which countries represented the biggest opportunity, but also the fastest opportunity. In which countries could they sell there first and really gain a competitive advantage. In a second case study, we looked at a company that was well established within Latin America, but didn't have specific information on the types of products that they sold within hospitals, clinics, and diagnostic centers, and wanted to see how to go about that. We helped them map some complementary products across the region within each of these types of institutions in order to see where they had opportunities and which institutions they could go after on a very specific level. They then complemented this information with some primary research in order to understand the drivers and the uses for their equipment and their services. Finally, we also helped a company that was very well established within Latin America, a leader across the board. And what they wanted to understand was how to reduce their blind spots. So they had a very tight and efficient sales force. However, they understood that their sales force did not always look at the entire market. So we helped them understand where their blind spots were by mapping institutions such as hospitals and clinics and seeing how these institutions were using equipment such as their own in order to detect purchase opportunities on the hospital side, which then in turn helped them grow their market by approximately 15%.